stress. So Dr. Patricia Farrell is a clinical psychologist and writer. She has experience in the field of mental health as a practicing clinician, medical writer, researcher, and educator. Her work is focused on controlling anxiety related to medical illness. She was formerly the National Clinical Monitor for Mount Sinai Medical Center, probably before Fred Lublin got there, but she was involved in the first national protocol for Alzheimer's disease called Cognex, as those of you who remember that. She works as a moderator for WebMD in the field of anxiety and panic, and she has appeared on such national TV shows as The Today Show, Good Morning America, Anderson Cooper 360, The View. Who was on The View when you were on The View? Who was the instigator? Is that one of the... Don't answer that. But that conservative blonde, I don't know about her. Inside Edition, Crier Alive, E!, The O'Reilly Factor, CNN, National Geographic, Court TV, Fox and Friends, VH1, ABC World News, and she even speaks Japanese on the Fuji TV. And she also has been on MSNBC. She's been interviewed by national magazines and newspapers where she comments on current events. It's my true pleasure to introduce to you now Dr. Patricia Farrell.
Thank you, Randy. After that, what am I going to say? I mean, you're sitting out there saying, who'd she appear with? Well, let me tell you. First of all, if you like Meredith Vieira, she's a super lady, and I can tell you from personal experience, she is a number one. The other thing that I can tell you today is that I am really pleased to be with you today because people in the helping professions I hold in the highest regard, and I will always feel that way. So thank you for doing all the good work you do, and let's even do better work for the patients that we serve. Depending on the research that you look at, 7 to 22% of the people in this country suffer from injection blood phobia. So it's fairly common. So when you have people come to you and say things like, I can't do that. No, I'd never be able to give myself an injection. You don't know, I'm afraid. Oh, it's terrible. Listen, lots of other people feel that way. And there are many things that you can do that you never thought you could do. And tonight we're going to show you a little something. But what do we want to do for our patients? The kinds of things, the kinds of feelings that they express to us. One thing that they want us to do is help them to become empowered. They want to be able to feel that they are in charge of their treatment in some way, okay? They want to have their self-esteem lifted. They don't want to feel that they are impaired, that they are fragile, that they don't have the life that they would like to have. There are so many things that affect them. And if you've ever read anything in the field, and I started reading this stuff about 25, 30 years ago, and I was really impressed by it. If you read anything in the field of PNI, psychoneuroimmunology, you know that anxiety and the immune system are linked together and they work together. So one of the best things that you can do, in addition to helping your patient remain compliant with their medication, is to help them to decrease their anxiety. Because if they decrease their anxiety, they feel better about themselves. They also handle depression, because anxiety and depression come together. I call them the ugly twins, they come together all the time. The other thing that you will help them with is you will help them be able to inject easier, because you cannot be anxious and relaxed at the same time. We're going to teach them to relax. The pain threshold will not be down where it was, it will be up, so that they will be able to endure painful injections that they thought before. They will be able to handle them better, okay? So all of these things we're going to help them with, and we're going to help them in very simple ways. One of the ways that we're going to help them, we'll talk in a minute, is that we're going to give them independence by handling that anxiety, by handling their ability to self-inject. They are not going to be dependent on other people. We are going to help them with having some kind of routine so that just as they brush their teeth every day, we're going to help them. This is part of your everyday routine. It's no big deal, okay? But it does have a big deal in terms of your future and how you will be able to continue to function well. You are going to be not only an effective support system for them and an important person for them, you are going to be somebody who is going to coach them. You are going to be there for them. And let me tell you, anybody who has a chronic illness needs somebody who's there for them. You're there for them 7 days a week, 24 hours a day. Do you know how good that feels? That is incredible. Of course they love you. Of course they listen to you. You're going to help them even more, right? But before we do that, what I want to do is we're going to change their belief systems. Now, you're going to say probably the hardest thing in the world to do is to change somebody's belief system. And I agree with you to a certain extent, okay? Let me ask you to do something for me right now, okay? How many of you can wiggle your ears? Just raise your hand, please. 2, 3, 4, 5. Got about 5 people, 6 maybe? That's all? And the rest of you, what do you believe? You can or can't wiggle your ears? Well, come on. Can you? No fair using hands, no fair. No, no, no. You think you can't do it? Well, that's what your patient comes in feeling. Your patient comes in feeling, I can't do this. And you keep saying, no, yes, you can. Yes, you can. You have to, we're going to teach you, you have to practice. Well, let me tell you, I'm going to give you an assignment. After you leave here tonight, I want every single one of you who can't wiggle your ears to start teaching yourself. I can't tell you how to do it. You're going to learn it on your own.
You can't go to sleep.
Right? You're going to learn, and every single day I want you to stand in front of that mirror and try to wiggle your ears. Now, can I do it? Yes. But can I do it excessively? No. And I can't do it the way your dog and cat can do it. Otherwise, I'd be a wow at a party, let me tell you. Would I just stand there and my ear would go, you know, listen, just go, listen to the room, okay? But you can wiggle your ears. And patients can do more than they ever thought they could do. And one of the things you're going to do is you're going to teach them that simply breathing is going to be an incredibly relaxing exercise. Now, when I say breathing, I'm not going to talk about the kind of breathing that causes you to walk around with your stomach sticking out, okay? Which most people say, no, you have to do that kind of breathing. That's really the only kind of breathing. No, excuse me, that's not right, okay? In my experience, what's the reason you do relaxation breathing? What does it do for you? Anybody have any idea? You ever try relaxation breathing? Anybody ever do it? Don't tell me you've never done it. Nobody ever taught you? Nobody ever taught you? Oh, that's a sin. That's absolutely unacceptable. First of all, as people in the healthcare professions, you happen to suffer a great deal of burnout. And one of the best ways that you can handle burnout is learning relaxation breathing. And you can do it every day. You can do it no matter where you are. You can do it with your eyes open or closed. You can do it while you're waiting for the elevator. You can walk down the hall to get a glass of water or whatever. You can do it anywhere, and you can do it as much as you want every day. Of course, you don't want to do it so much that you pass out. That just that would be terribly relaxed, but just not what you need to do. Okay. All you have to do is, let's do it now, okay? Want to try it? Very simple. You want to close your eyes? Promise nothing bad will happen. You can close your eyes. My students used to say all the time, no. I said, well, you can leave your eyes open. It's okay. Close your eyes. Now, what I would like you to do is very simply, we're going to do a brief relaxation exercise, very simply. All you're going to do is breathe in through your nose. You're going to hold it for a slow count of 5. And while you're holding that count, all I want you to do is to consider where your shoulders are, where your arms are, where your feet are. That's all. 1, 2, 3, 4, 5. Now breathe out through your mouth. Now let's try it again. Breathe in through your nose, nice deep breath. Remember, breathe and think about where your shoulders are, where your arms are, where your feet are. 1, 2, 3, 4, 5. Breathe out through your mouth, okay? Okay, do it again. Breathe in through your nose, where are your feet and your legs. 1, 2, 3, 4, 5. Breathe out through your mouth. We'll do it once more. Breathe in through your nose. Hold it for a count of 5. Where are your arms and your hands? 1, 2, 3, 4, 5. Breathe out through your mouth. Okay, now open your eyes. How do you feel? How do you feel? Okay? Feel a little more relaxed? You're going to do it all the time, and you're going to teach this to your patients. And you know what the biology behind this is? This isn't just a distraction technique. This actually has very good biological basis. Actually, what it does is it changes the chemistry of your blood. You don't have as much oxygen available, correct? It changes, it brings the CO2 up. So what happens when you bring the CO2 up? You start relaxing, okay? So it's a scientifically good way to relax. Very easy, do it anywhere, anytime. Make sure all of your patients learn. It'll take them 3 minutes to learn, 2 minutes to learn. Do it slowly enough, and they could do it anytime. And they could teach it to anybody they want to teach it to. Their entire family can learn to relax. They can do it with their eyes open, their eyes closed. It doesn't matter. It is one of the best things that I ever learned, that I helped people with, and they learned. In fact, somebody said to me, you know, it was like taking a tranquilizer. I mean, it was just like taking a tranquilizer. You can do it up to 5 times. We did it 3 or 4 times. You can do it up to 5 times. I wouldn't do it more than that. You don't have to, okay? But you're going to go. You're going to wiggle your ears tonight. You're going to wiggle your ears tomorrow. You're going to practice your relaxation breathing, and you're going to go back, and you're going to help your patients. You're going to say, look, you know, I had this crazy doctor up there. She's this television person. And you know what she asked us to do? She asked us to wiggle their ears. But you know what? It really opened my eyes to the fact that, yes, in fact, you may feel that you can't do something. Because believe me, I felt I couldn't wiggle my ears. Now, Randy will say to you, oh, it's genetic. Genetic. Not everybody can do it. Well, okay, fine. But try it. Try it. I could do a couple of other genetic things too. I'm not going to show you those. There are these little genes that we have that I don't know what they were ever used for, right? I don't know. Maybe I'm a throwback to a Portuguese water spaniel, but we can do a lot of things that we never thought we could. Okay, we can take charge of our lives. We can be important in our treatment, in our lives. We can be future focused, and that's a very important thing. And when you start reading the 10 barrier busters that we've come up with, they're very simple. Positive self-talk, very simple, very helpful. All of you, I'm sure, you're going up a flight of stairs. What's one thing you say to yourself immediately without even thinking? Oh gosh, I hope I don't trip, right? And what happens? Yeah, you trip, okay? So what have you done? You've set yourself up. Let's set yourself up the other way. Let's set yourself up in a positive way. I'm going to do this. I will do this. I can do this. All of the positive kinds of phrases. Anytime you feel let down a little bit, think about the positive side. Yes, I will be better. Yes, I may not feel so great today, right? But it's going to help me in the future, and I'm going to do things for my future because my future is important. I am important, and I am powerful. I am going to empower myself, and I've got a great coach. I've got a great team behind me. I've got people who are there for me, so I don't have to do this alone, and that's a great help. So, did I use my 15 minutes? Did I? Are you too relaxed and you just can't move, right? Yes?
It's up to you.
Okay, so, have you heard enough of me, or do you want to hear gossip? Want to hear gossip? People love gossip. Two of the finest people I've ever met in television are Meredith Vieira and Anderson Cooper. Two of the sweetest, nicest people. There's one person I shall not name. I shall not name. He happens to be 6'4". He likes blondes. Usually has them on a show, but I just won't. It's just not a show for me, you know. When I
Leave it at that. Now, come on now.
He's on YouTube right now, and he's saying that he was forced contractually to do that. Do you have any ideas?
No.
Come on, you do. You do. Come on, give me the name. There you go. Yes. My dear friend Bill, who is, he's okay, but not for me. I prefer to go on television and be the voice of reason. I feel we have too many people going on television these days who are psychologists or psychology experts or psychotherapists. Go to my website someday, drfarrell.net, and please read what I have to say on therapy. And if you want, read my book and see what I have to say about going into therapy and the questions you have a right to ask, and they must answer, and do not ever feel that you are one down and they are one up. No, no, no. A Ph.D. does not give you a right to be God, okay? So go forth and help your patients, and thank you for being here tonight.
Well, thank you, Dr. Farrell. You know, she doesn't know it, but I knew one of her patients once. He went to see her because he was always nervous and he had trouble getting to sleep. And Dr. Farrell talked to him and said, you know, when you get into bed, I want you to do this breathing technique, and I